Hi everyone. Today, me, Natalie, and Brooke are going to be talking about microvascular angina.
We are going to start off by talking about the relevance of microvascular angina. MVA goes largely unrecognized due to the more common form of angina and the difficulty in diagnosis. MVA occurs without the presence of coronary artery disease and is often dismissed as stress, anxiety, or gastrointestinal issues. Women present with greater numbers, and there is an increased risk of heart attack, stroke, heart failure, and possibly death. It is also important for the exploration of future testing and treatment options. Next, we will be talking about the importance of medical and pharmacological history and updates. A client may be showing signs that can be overlooked or dismissed. Therefore, it goes undiagnosed and the client does not receive proper treatment. Medical clearance is required if angina is uncontrolled, because there is always the potential for a medical emergency. It is important to note that treatment should also be deferred if a client's angina is uncontrolled. Unlike the more common form of angina, nitroglycerin may not provide relief for MVA. You should always note if the client is taking other medications to help control their condition. And lastly, it is important to make an appointment that suits the client's needs.
The pathophysiology of microvascular angina. So the blood vessels that branch off of the coronary arteries are narrow, and these arteries are the smaller blood vessels that provide the heart muscle with oxygen-rich blood. When the amount of oxygen in the blood is reduced, this is what causes the symptoms such as chest pain. The arteries of an individual with microvascular angina have the tendency of vasoconstriction when stimulated by chemicals such as acetylcholine, and this is also how they test for the condition. Endothelial dysfunction and the smooth muscles start to constrict, and it causes epicardial vasospasm-induced ischemia. The signs and symptoms include chest pain during physical exertion, as well as due to emotional reasons such as stress, and this can last up to 30 minutes. There's also shortness of breath, fatigue, lethargy, and sleeping problems, and discomfort can also occur in the shoulders, neck, arms, jaw, and back. Risk factors include high cholesterol, high blood pressure, smoking, diabetes, lack of exercise, an unhealthy diet, and older age. And the onset can also occur at unusual times, such as rest, and this is very specific to microvascular angina.
Treatments for angina and microvascular angina have similarities and differences. Current therapies for angina include beta blockers, calcium channel blockers, short action nitroglycerin, aspirin, and ranolazine. But the most important difference is that with angina, they have procedures such as coronary bypass graft surgery and percutaneous coronary intervention, which is also known as a stent. And since microvascular angina works in such a microscopic level, it is much harder to follow the same procedures. Therefore, the doctors must rely on the medication a bit more. The medications include ACE inhibitors, which are heart medications that widen or dilate your blood vessels, therefore increasing the amount of blood pumping through your heart, and it lowers the blood pressure. Statins lower the level of cholesterol in your blood by reducing the production of cholesterol by the liver by blocking the enzyme that is responsible for making them. Beta blockers, which are responsible for improving the symptoms, especially with patients with effort-induced angina. And calcium channel blockers are effective with angina patients that are at rest, and it helps with their symptoms over time since they are so unpredictable. There's also nitrates, which are not as effective, and so that's why they suggest more potassium channel openers such as nicorandil, and they also have ranolazane. And lastly, doctors always emphasize lifestyle changes such as weight loss, smoking cessation, and cardio rehabilitation programs.
So, when to refer the client? If it's uncontrolled, or they feel symptoms are worsening, or they haven't received medical attention or undergone the process of diagnosing the condition, and the client displays symptoms of angina, the client should be referred for a medical consult. Clients may require more intensive diagnostic procedures. So, typical diagnosis of angina is done using invasive coronary angiography, and it identifies obstructed larger arteries, but it's not able to recognize the smaller arteries that are causing microvascular angina, so a more extensive diagnostic procedure is required. So, interventional diagnostic procedures are typically done to the left anterior descending coronary artery using a guide wire to assess the blood flow and the restriction in the microvascular arteries while both at rest and hyperemia, which is when there's an excess of blood. So the artery will then be tested for the tendency of vasoconstriction when stimulated by acetylcholine. So this simulates the behavior of the artery when naturally affected during a parasympathetic response, and the smooth muscle usually relaxes to increase blood flow. But when given acetylcholine in higher doses, or there is a case of endothelial dysfunction, it will cause the smooth muscle to constrict and can cause epicardial or microvascular vasospasms and ischemia. This is an opposite response to what would naturally happen in the presence of acetylcholine, so increased resistance would be a sign of microvascular dysfunction.
For the interview portion, we interviewed Shanti Costa, who is a retired nurse and also my grandaunt. We asked her a couple of questions, like protocols that were put in place when there's an emergency, and she said it's mostly just nitroglycerin to help more with the immediate effects and to help them relax. And the next question would be, have you heard of microvascular angina? If not, have you heard cases that were close to it? So since she is retired, she's been out of the workforce for quite a hot second. And so she replied with the fact that she did not know what microvascular angina was, and I further explained to her what the symptoms are and what it is, which changed her answers a little bit. And she said she recalled symptoms that seemed to be close to those diagnoses, and they were most likely to go into the MRI or the PET to get a test, but they were just too small to detect at the time. We then asked her, with chest pain, was blocked arteries checked for first, and how is this checked for? And she replied with, angina is not always the first thing that doctors look for, because they have to keep their options open for other possible diagnoses, such as heartburn or heart attacks. But as soon as symptoms were more clear, it was easier for the doctors to make the decision, leading to the diagnosis of angina. As for how it was checked, it would be a cardiac angiography, which was used to check the arteries to the heart and how much the blood flow was blocked. The next question we asked was, is there a correlation between angina and women? And she said the cases for angina seem to be more related to men, but the cases that we were talking about where the symptoms didn't correlate with the diagnoses were more found in women. And then lastly, we asked, what are some of the characteristics of the lifestyle of the people that are presented with angina? And she said that majority of it was people who smoked, had an unhealthy diet, weren't exercising, had higher cholesterol and blood pressure, or just higher amounts of stress in their lives. That concludes our presentation on microvascular angina. Thank you for listening. I hope you liked it, and I hope you have a great day.